this section of lecture will cover ADHD, which is another childhood disorder. So there's a couple of core characteristics associated with ADHD, and basically ADHD involves some combination of inattention, hyperactivity, and impulsivity over time. So inattention is the inability to focus. So individuals with ADHD get sidetracked, struggle to finish a task because they start something new. So maybe kind of if a child is trying to do a math problem and their mind keeps wandering and they can't focus. Hyperactivity is physically constantly moving. So doing things like fidgeting at their desk, getting out of their chair, moving their hands, playing with their hair. All of those can be kind of symptoms or indicators of hyperactivity. And then finally, impulsivity is making decisions without thinking them through. So cutting in line, breaking the rules, possibly hurting other people, not necessarily with malicious intentions, but because they're not thinking about the consequences. They're just thinking about what they want to do in the immediate moment. So in order to be diagnosed with ADHD, an individual doesn't have to have all of these characteristics. They can have one or more combined, but they do need to be present before age 7, which is one of the reasons why this is a childhood disorder. Another condition of ADHD is that the problems need to be evident in multiple domains. So if a child is just showing hyperactivity at school, but in no other context, then it's an indicator that it could be a problem with the school classroom or the teacher's expectations, not necessarily a sign of the disorder. So the problem has to present itself in terms of school or home or socially in multiple different domains. If the kid is completely fine at home and socially but can't sit still at school, could be a problem with the school. So when there's problems in multiple domains, it indicates that there's a pervasive problem causing significant impairment. Rates of ADHD have almost doubled since the 90s, and it's 4 to 5 times more likely in boys than girls. There's a lot more awareness of it, and potentially that could result in more misdiagnosis. But generally, kids are diagnosed in elementary school. Sometimes you find that ADHD decreases in adolescence. So one of the big types of deficits that we see in individuals with ADHD is problems with self-regulation. They struggle to control their own emotions, their cognitions, and their behavior, and this includes both problems with automatic and controlled processes. And this really ties into impairments in executive functioning. So executive functioning is really in charge of goal-directed behavior. And so there's a couple of components. So inhibition is a big one. So inhibition is blocking an automatic response for a bigger goal. So if you remember, we talked about the Stroop task where you see a color. So you see the word red, but the word red is written in green. And you have to inhibit the urge to read the word red in order to say what color it's printed in. Similarly, when you're in class, you have to resist the urge to play on your iPad in order to focus on your class reading. Working memory is another component of executive functioning, so being able to do mental manipulations and calculations. And then shifting, so being able to change task and focus from one thing to another thing. In younger kids, a classic test of this is the card sorting task, where they have a pile of cards with shapes of different colors. First, they're asked to sort the cards by color, and then they have to switch and sort the cards by shape. And so kids with ADHD have a really hard time shifting their attention from the color to the shape. So there are significant potential consequences for a child having ADHD, and it can go beyond just academics. Impulsivity means that they can do things and have accidents that can lead to increased injuries. Peers may find that kind of hyperactive behavior annoying and irritating, so it can lead to peer problems, and it may cause issues focusing in school, academically. And we also see a lot of comorbidity, meaning it coexists with a lot of other disorders, most commonly anxiety and depression. In terms of the developmental course of ADHD, what does it look like over time? There are three general long-term outcomes. One is developmental delay, where you see gradual improvement. So kids are really having a hard time in elementary school, but eventually they start to get better. They start to get it under control. We'll talk about treatment options that might help that. But the hyperactive, the impulsive kind of symptoms fade over time. For some kids, you see a continual display where they have continuing ongoing impairment. You see problems in first grade, you see problems in fifth grade. It's continuing to create issues. Or a third possibility is you see developmental decay, where they have ongoing impairment and potentially additional psychopathology. So maybe another disorder, maybe they also develop depression or anxiety. And so especially these kids who have ADHD and something else, we tend to see their outcomes get worse over time rather than better. Generally, ADHD is relatively stable across the lifespan. It's not diagnosed normally until childhood, but there's some evidence that babies who have difficult temperament, so babies who are more fussy in infancy, are at higher risk for developing ADHD. We used to kind of think that people will grow out of it, but really just the form of ADHD looks differently. So in kids, impulsivity might be throwing something or making a big mess. In adults, impulsivity might be something like quitting your job when you've had a really bad day. Adults with ADHD, we know, have more job transitions, and I think this is just another indicator of these same kind of problems exhibiting themselves in a different way. And about 1/2 to 2/3 of adults continue to experience ADHD-related problems, so they don't grow out of it. So we know that kids or individuals with ADHD have significant brain differences. So the frontal lobes, anterior cingulate cortex, corpus callosum, temporal lobes, and striatal regions have all been examined as potential sources for the differences. We also know that certain neurotransmitters like dopamine and serotonin may be implicated in ADHD. So a number of biological causes. In terms of the things that lead to these, one is genetic inheritance. We know that ADHD is pretty highly heritable, although again, like autism, it's not one single gene. There's multiple genes in combination. There's also the potential that it could be the result of some kind of brain damage very early in development. So during prenatal development or postnatally, we know it's associated with things like maternal and family cigarette use. But also possibly alcohol exposure or low birth weight we know are associated with higher risk for ADHD, and it could be because they've caused some kind of neurological damage. It's also linked to personality traits and temperament, and these things can make ADHD better or worse. In terms of treatment for ADHD, by far the most common treatments for children with ADHD is stimulant medication, and there's significant evidence that this treatment leads to significant and sustained improvement. There are also a number of psychosocial interventions that generally target kind of the symptoms associated with ADHD, including kind of diminished self-esteem and depression and parent-child conflicts. So psychosocial interventions might include things like you see in this image, providing positive attention, giving effective, clear instructions, praising effort, giving rewards, using consequences. And a lot of times these interventions have kind of multiple targets, right? So they train the parents, they use specific interventions targeted for the kids. They use behaviorally oriented peer interventions as well, teach the kids social skills. So by targeting it from multiple different areas, the goal is that we can really give kids kind of effective tools for managing this. And the most effective school-based interventions involve behavior contingency management. So these are reward systems or point system, timeout for inappropriate behavior, those kinds of things. The best treatment really seems to be a combination of medication and behavioral interventions. And interestingly, in adults, medication can also help adults with ADHD with occupational and marital functioning, which we know they have problems. So stimulant medication can significantly help even into adulthood. And cognitive training interventions and complementary treatments and earlier interventions continue to be investigated. So there's lots of other possibilities. ADHD is something that, while it generally is relatively stable, it's something that we are pretty effective at treating and eliminating at least the impairments associated with the symptoms. And that's all for this one.